Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about advice for your first 2 years in the medical coding field. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if this is your first time becoming a medical coder and you are out there and you're looking for your first job and you're like, gosh, I wish I had some advice, this video is for you. So here we go. The first thing that I will say about the medical coding career field, or medical billing and coding, whichever one you're getting into, is going to be a test of your patience for the first 2 years. And I say the first 2 years because the first 2 years is where most of the learning happens. And then after those 2 years, it's going to be like gaining and maintaining your knowledge. So that's why I say we're talking about the first 2 years. But the first 2 years is really going to test your patience. Things will not happen fast. That's just the long and short of it. Things will not happen fast. You may struggle in the beginning to find your first job. It is difficult because employers don't want to have to train new medical coders, especially new medical coders that come out of really fast-paced medical coding schools, which a lot of these training programs are very fast, like less than 6 months fast. You know, a good size program would be something that is 9 months, 12 months, or 18 months. And so I say it takes that long because even if you have a background in medical already, it doesn't matter. When it comes to what we have to know what doctors know while never having gone to medical school. And there is no truer saying than that. So watch your patience level, because if you are the type of person that gets very frustrated right away and then you want to go to LinkedIn, or you want to go to Instagram or Twitter or Facebook or something like that and complain that you're having a hard time finding a job and that it stinks not being able to have anybody hire you because you're brand new without experience, this is a bad thing, because medical coding and the medical coding field is a very small industry. Even though there are thousands of us, it is a very small community, and word will get around quickly about your attitude. So if you are complaining out there, they're not going to want to hire somebody who complains. Okay, they're going to want to hire people who are problem solvers, and people who are proactive, and people who are positive about what they're doing and why they're doing this. And yes, while some people are doing this to chase the money, if you're doing that, that's a wrong way to be, because it's a lot of work if you're trying to chase the money with this. Medical coders get paid very well, but you also have to put a lot of effort in. And in these first 2 years, you're going to be learning things that the book did not teach you and that the schools did not teach you. Schools are not about the whole package. They are about selling you a product, which is a brand new future, and they're guaranteeing, a lot of them will guarantee that, oh yeah, we guarantee that you'll be able to pass a certification exam. Well, they may do that by teaching testing strategies, but you can't rely on testing strategies to get you all the way through these exams. You may get lucky and you may pass, but that doesn't mean that you're going to pass the employer assessment tests, which will happen. Every medical coder, regardless of if you have no experience or if you have tons of experience, we are all tested, because the employer needs to know what your knowledge range is, okay? Which is why I tell new people that when you are applying, don't be afraid to apply for places that are asking for experience. Everybody's looking for those magical, this is an entry-level position and we welcome brand new medical coders, will roll out the red carpet for you. No. Even if you do find those entry-level positions, there's going to be about 1,000 people that you have to compete with, because everybody is looking for those entry-level words. But passing the certification exam says that you are competent to code. This says that you are competent, that you know the base knowledge that you have to know to be able to get in. The rest is up to you. So if you go ahead and you apply for these places that are asking for experience, and when, you know, happy coders in that area are not going to try to look for other jobs. They're going to stay right where they are. So sometimes that employer is just going to have to take whoever applies. Again, if you are showing that you have that initiative to go ahead and apply anyway, and then if they say, okay, we're going to go ahead and give this person a test and see their knowledge base and see what they can provide for us. And if you do really well on this test, you may be getting a call back and say, hey, we really need somebody, and you're passing all the markers, let's do an interview. So that's when you're on your way. But if you're going to sit on the sidelines and you're going to be scared off just because they're asking for experience, then you're going to be waiting a long time. And what happens in these first 2 years also to the industry is that a lot of people, it'll lose a lot of talent. The industry loses a lot of talent in the first 2 years of a medical coder having their certification, because if they can't find a job right away, they want to quit, and a lot of them do. They don't even take the certification exam, but they complete a program, but they psych themselves up to make themselves so scared of taking the test. And when it's just a test, it's not testing you on anything that you haven't already covered. You've covered everything, right? That's on these exams when you're prepping for these tests. And if you take the time to study the 20 hours a week, like I tell y'all to, your chances of passing are going to be higher, because this is going to be more familiar to you. But that aside, the industry loses a lot of talent during this time because people don't want to take the test. They're too scared. They're not proactive enough to find a mentor, find a tutor, somebody that can help them if their school did not help them to understand. Okay, so that's just something that you all ought to know. These things, again, they take time, and it takes a lot of effort on your part. And if you find that you're not getting any calls back from the places that you're applying to, and you think it may have something to do with your resume, you're probably right. Resumes should be 1 page, no more than 2 pages. And they should go back no more than 10 or 15 years of your work history. And if you have no previous background in medical, it's okay. On your skills, you need to put everything that you learned in that program. You do not need to put that you are organized, that you're a team player, that you have a smiling face, because if I am a hiring manager, I am going to immediately reject that resume because that person did not know the assignment, did not understand the assignment, which is, tell me what your skills are. I've got about 2 seconds to look, 10 seconds actually, to look at your resume. It needs to be upfront, and you need to tell me exactly what you are bringing me as the employer. And so that's what you have to do. You have to be very straightforward. No one has time for people to beat around the bush or to be shy or to act coy. That also happens as well, where people think, oh, if I act coy, like a bunch of people want me, then they'll want me even more. No, not when you're a brand new medical coder. When you have experience, oh yeah, then you can start doing this little negotiation thing that you hear about. But when you are brand new and you have no experience, you need to be very Johnny or Janie on the spot. You need to make sure that you are right there and you are prepared, and you get back to them timely. If they give you a test, you give it back to them as quickly as you can, all right? Take your time with the questions, but get back to them as quickly as possible. And don't say, oh, well, I need a week, or, I need this or I need that. Do you want to get this job? Yes or no? And if they're giving you a chance, then you got to seize that chance. There's a lot of resume writers out there. I'm a resume writer myself. My rate is in the description box below. I have tons of videos on my channel, y'all. So you don't even have to hire somebody. Watch those videos on my channel. Don't ask me for the specific ones because you can go through my videos. I do them plenty of times. I swear I talk about resumes at least once a month on a video. But go through those videos and write it yourself. I mean, it's always possible to do things yourself as well. But if you absolutely have to farm it out, make sure that you find somebody who is competent about the industry and not somebody who's a so-called professional who uses a blank same thing for everybody. You don't want that. You want somebody who knows the industry. You want somebody who has been in the industry, who knows what employers are looking for, those key words. That's very important. So I'm just saying. But the other thing that I want to say is this. When you do get into these jobs, and let's just say, okay, you've made it past that hard part. You've made it past getting your first job. So, okay, you're at your first job. This is when you have to be proactive the most, because complacency can set in really fast, especially if you are not being really verbal about the things that you want to do in your career. So if they say that, like, just say for instance, they need volunteers to code in a clinic that you don't normally code for, then you're going to say, hey, I'm ready, put me in, coach. Because you want to be proactive. You want to show that you are willing to be a team player and that you're willing to learn. And is it uncomfortable not to know and understand things right away? Of course. But the great thing about our field is that you can do tons of research, and there's tons of things out there for coding about the specialties. And so it just takes you to just do a little bit of letting your fingers do the walking through Google, and you'll be able to find your way and you'll be able to figure it out. You know, it's not anything that's scary, guys. People will get wrapped up into positions like risk adjustment, right? Well, risk adjustment, that's only diagnosis coding. And they mainly do it for like statistical reasons and things like that. That's the main purpose of it. There's other purposes for it now. But risk adjustment is only diagnosis coding. And some people get very excited about this, and they say, well, Blue, if you know, I don't have to do anything with E&M, evaluation and management, I don't have to do anything with procedures or modifiers, this is so fantastic, and I'm just going to stay right here. The problem is that you can get bored after a while. So I tell people, if that's the first place that you can absolutely get into, then go for it. But stay there 6 to 8 months, you know, and move on. Continue to look for other work. And if you say, well, Blue, I don't feel comfortable with that, I feel like it's going to show that I'm hopping from job to job. Everybody knows in the beginning you're working on getting experience. And it's okay if the place that you're working at doesn't align with your future goals for growth. It doesn't hurt to move on. It doesn't hurt to expand your horizons and see what else is out there. Now, always have another job lined up before you leave one. Never leave yourself without a job, okay? That's the biggest thing there, is, you know, make sure that you do that. And so that way you can get the most experience you can. When I started at my second job in medical coding, which was about, I had my first assignment for 3 months, and then I immediately went to the next assignment. And so I only had three months in the field. And so when I went to the second place, the first thing that my boss had said to me was, we have a position in professional fee coding, pro fee coding. Would you like to do that? I'm like, I just moved here, so put me in, coach, wherever. I'm fine with it. Just tell me what to do, you know, just give me some direction. And so she was totally fine with that. And I was able to learn professional fee coding. And with professional fee coding, that's all the specialties. It wasn't just one specialty. It was all specialties. So I got to dip my hands into everything, which was really great because it lined me up for my next position, which was at my forever home, which is where I am now. And that's another thing that you got to know too when you're first starting out, that the first job that you get may not be your forever home. A lot of people are under the misconception that, oh, the first place that I want to get, you know, they have to pay me a high salary. I have to be able to work at home. I have to be able to do all these things that I want to do because I haven't earned it yet. So that's not the way that it is. Your first place may not be your forever home. Okay, for a very small percentage of people, it is. But for the vast majority of us, it's not. It's the first place that we get experience and we move on. The first position I had for 3 months, they told me, we have no other positions here in my hometown, except we do have another position, and it's a longer position, and it's a contract. So, you know, you can take that position, but, you know, you'll have to pay for yourself to move. You know, I had to move. Okay, I'm not telling y'all to move. Do not write me and tell me I can't move. Don't do that. I'm telling you my story and what I had to do. And in those first 2 years, again, it was about taking those calculated risks, which that was a calculated risk to move so far away from my hometown, and I had no social circle. I had nobody around me, and I was a brand new coder still learning this field, and then having to live on my own and things like that. It was scary, but I went at it because you have to have the attitude of failure is not an option, and that is so critical in the first 2 years. Failure is not an option. And the more you tell yourself that, the more you're going to believe it. So you have to make sure that you're ready for those challenges, that you're going to be patient with yourself, because again, there's going to be things that you don't know. And if you don't know something, find a mentor or find a tutor. There are a ton of mentors and tutors on LinkedIn. I am a tutor myself. I'm not a mentor, but I am a tutor. My rate is in the description box below. And there's tons of people out there that are willing to help you, but you have to be able to say, hey, I don't know. And you also have to be willing to, again, do a little bit of effort and make sure that you are doing your research so that you can figure these things out, along the way. But the other thing that I will say about the first 2 years is the joy that you will get from the first time that you pass your audits and you say, okay, I'm doing this. This is really great. This is awesome. And you're going through this and you're building your confidence. That's going to happen in these first 2 years. And then be ready for it, because just like everything goes up, something must come down. So maybe in the next month, you may not have such a good score on your audits, but that's okay. It's a learning process. And so don't be too down on yourself. Don't panic. You're not going to get fired because you failed one audit. It's just a matter of learning, okay? You're going to be exposed to all kinds of people and all kinds of age ranges, okay? This field is open to everybody, from just out of high school to I've retired and I'm now coming back to the workforce because I hate being retired and I want to do something for myself and I want to do medical coding. You'll have all of those types of people in between, okay? And so if you are a little bit older, your boss may be younger than you, okay? If you are younger, right out of high school, your boss may be somebody who is old enough to be your mom or your dad, So that's something that you have to think about too. But it's a professional environment, and for the most part, most of us are nerds. Most of us are nerds, and we get together and we talk coder, and it's fun, and you'll learn that along the way as well. And it's not something that you may be in love with right out of the gate either, because you're going to think, oh my gosh, all this studying, I hate this. What did I do to myself? But I'm telling you guys, if you just stick with it, just put in some more effort to learn, the things that you can discover and the things that you'll remember and know, it's just like, I don't know. To me, it's the best thing in the world when I see in myself, when I learn something and I'm like, aha, and I had that aha moment. And then I go and I teach it back to somebody else and I see them have that, oh, I get it moment, and so I love that, and so that's, okay, I know, turn down the nerdy blue, I got it. But that's me, and that's what I really love. I love to learn, and that's just the best part of what I do. Yes, there are some task things that you do at work that you hate to do, but that's for me, the coding part is always the most fun part. At least that's just me and my experience anyway. But the thing that I will say to wrap up this video is, in these first 2 years, my people, please listen to me when I say this. Start off with one certification. Just spend your time with one certification. There is no need to be in your first 2 years with a slew of credentials, all saying what you've been tested on with the original test, okay? Because all of the 4 main medical coding certifications, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, and the CPC, all 4 of these all test us on outpatient coding, reimbursement, diagnosis coding, auditing. It's all being tested in there somehow, some way. All of those things are being tested on all 4 of those. All you need to start is one certification. That's it. And if you don't believe me, you think, oh, well, no, Blue, my teacher said that I need multiple credentials so that I can make more money. No, you make more money having more knowledge, having more experience. That's how you make more money, not based on the amount of credentials that you have, right? Because when you look at the job listings will say candidate must have an American Health Information Management Association or American Academy of Professional Coder credential. Must have CCS, CCA, CCSP, or the CPC. And then sometimes they'll ask for the RHIA or the RHIT. Those are the degree designations. If you are looking to be a medical coder, do not waste your time with a degree, because the degrees are for people who want to be our leaders, our educators, provider educators. That's them. They want to be in supervisory roles. That's what the bulk of those programs is for. It's not for medical coding. The medical coding portion of those programs is very small, very small. The RHIT program, I guess it used to be more in depth on coding, and now it's very small because it's the majority of these programs is about ethics, medical law, right? And human resources and statistics and, you know, all of those things. And managing people, managing an organization, you know, about teaching and how to do those kinds of things. That's what those things, those programs are created for, not for medical coding. And for people who say, well, no, at my facility, we have only degree holders. Okay, that's not true, because I have never seen them only say we only accept degree holders. Because if they'd say that, then that's somebody that clearly does not know what these medical coding credentials do. I'm just saying. So it's not something, this field is very different from a lot of other fields. And there's a lot of people that talk about it like they know. So you have to be very careful about who you listen to, even if it is your instructor, okay? Even if it is, I'm a nurse and I know. No, if a nurse has never been a medical coder, they do not know. They do not know. And I'm not saying that to be fresh or anything like that with anybody, but what I am saying is this. I've seen a lot of nurses say things about medical coding that are not even true. And when it comes to what we do, we have to look and we have to read and comprehend these documents. We are not selecting diagnoses from a super bill, okay? We actually have to think it out, look at it, and make sure that everything is there and everything fits. So that's what we do as medical coders. And medical coding is not nursing. It is something completely different. And so that's the thing that I will say to this, because I know there's a lot of nurses that are getting into medical coding. And I think that's fantastic because they have a great, vast knowledge base. But anybody can have that knowledge base as well with some effort. Okay, it takes effort because we got to know a lot. We got to know deep stuff too. It is not just surface things, you know, like how these schools, they train you. With the majority of the schools, the way they train is for surface knowledge. It's not that in-depth knowledge. The in-depth knowledge you'll get in the real world. But you have to go after it as well. Okay, guys? So at least that's just my advice anyway. So start your first 2 years with one certification. Make it easy for yourself, because this is a very expensive field. And because of this, you have to be very mindful about what you're spending your money on. The more credentials you have, the more you're going to have to put out in continuing education units. And sometimes with certain credentials, you have to have specific vendor CEUs in order to be able to maintain it. And guess what? Those specific vendors can charge whatever they want to for a CEU. I'm just saying. So make it easy on yourselves. You got plenty to do. You got plenty to learn. Stick with one certification for the first 2 years. Learn what you can and then move on. If you start with a CPC and you say, hey, Blue, I think I want to get the CCS. Okay, wait the 2 years. Test yourself. Make sure that you're practicing on that inpatient side and the outpatient side. And then that way you can be prepared, fully prepared for that CCS. Because that CCS, you look at the pass-fail rates of that CCS test, and you'll see from the AHIMA website, ahima.org, ahima.org, you'll see that. That is a very serious test. And not a lot of people pass it on the first try. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.